Previously on The Life of JT.
Looking down, no
What up, Famous Minds family? It's your boy JT, and back by popular demand, another Storytime video. First off, I want to thank everybody that subscribed to my channel. If you're new here, go ahead and smash that subscribe button. It's free. Hit the bell for notifications so when you know when I make all new videos. And if you like these kind of Storytime videos, go ahead and smash that thumbs up. Usually when I do my Storytime videos, I have my green screen behind me, but I just didn't want to take out the time today to pull it out and set it up and everything like that. But we'll make a cool video. And this video is going to be a little bit different than most story times I usually make. I usually do kind of funny comedy ones. And this is going to kind of hit home, and it's going to kind of be a real life serious story. And this video is going to be called Living with Achalasia. I know you guys are wondering, what the heck is achalasia? Well, I'm going to go ahead and let the doctor explain what achalasia is.
Achalasia is a relatively uncommon condition that I see commonly in my clinic. It is a disease that affects the esophagus, and specifically the junction between the esophagus and the stomach, called the lower esophageal sphincter. So this is the esophagus as it comes down from the mouth through the chest, and this is our diaphragm, that's the separation between the chest and the belly. And this is the stomach, and the valve usually sits over here. Achalasia is a condition where the valve between the esophagus and the stomach fails to open. It also has a failure of the esophagus to contract in an organized fashion to propel the food down. Therefore, there's a blockage of this area that keeps people from being able to eat normally. And this is often mistaken for acid reflux because it's difficult to tell when food is coming back up from the stomach or food is just sitting there. The diagnosis of achalasia can be difficult to make. However, it can be made by a primary care physician or a gastroenterologist based on a few tests. The first test I would recommend is an endoscopy, where they put a camera down through the mouth into the stomach to see if there's any other reasons why there would be a blockage, such as cancer or stricture or narrowing from acid reflux. If that is not present, but the valve still appears tight or has high pressure, that is suggestive of achalasia. There's a barium esophagram where you drink some contrast and watch the contrast go down the esophagus and get blocked at the level of the sphincter or the junction. And the last one is something called a manometry, where we measure the pressure in the esophagus and the valve. Most often we find that the pressure at the valve, which is here, is very high, and there is no organized contraction in the esophagus in the other parts. With these tests, we can reliably confirm the presence of achalasia, leading you to the appropriate treatment.
You guys are probably wondering, well, how'd this happen? Is it genetic? Is it eating the wrong foods or something like that? Well, let's go ahead and get into this storytime video of me living with achalasia. First off, I want to tell you guys that achalasia is a non-curable disorder. So there's no cure for it. There's a lot of treatment options that can help you cope with it the rest of your life, but you'll have it the rest of your life. This whole nightmare started about 8 to 9 years ago. I remember I was working at this restaurant, and it was break time, so I grabbed my food, my drink, whatever, and I remember eating a little bit of food and go to take a drink, and I almost instantly threw up all my food. And at that point, I knew something just wasn't right. I kind of got that feeling like food was stuck in between my throat and my esophagus, and it wasn't going into my stomach. So I kind of blew it off, thinking, well, maybe I'm not chewing my food properly or chewing my food enough or eating slow enough or something like that. But over the next 6 months, it just progressively got worse and worse and worse. I was constantly throwing up food. I was trying to use water to wash it down, but most of the time it'd come back up, so I'd have to eat some food and drink some water over the sink and whatnot. I was never eating out in public. I was so scared to throw up at the table. So I didn't have a social life. It was just a big nightmare. Anybody that knows me personally knows I am not a big fan of doctors. I don't like needles, And it's funny because I got a lot of tattoos. I know people say, oh, you got tattoos, but it's different when they're shoving a needle into your veins. So I always used to avoid going to doctors no matter the situation, but I knew after throwing up food all the time, just something wasn't right. I had to go to a doctor. Another problem I had is I had no health insurance. So I knew if I went to a doctor that I was going to have to pay out of my pocket and start building up these hefty bills. I ended up going to a regular doctor, and they quickly sent me to an upper GI specialist, which you can only imagine the hefty bills I was starting to incur from these specialists, because specialists are very, very expensive. So the first specialist I go to, he tells me I have acid reflux, and I'm like, I don't know, it seems a little more than acid reflux. So he had me on heartburn medicine, I remember. And it was so funny because I couldn't even swallow the heartburn pills because I couldn't even swallow food. So the heartburn pills weren't even going into my stomach in anyway. So I knew that wasn't the problem. I ended up calling this doctor back, and I'm like, you know what? I can't even swallow the heartburn medicine. You know, it's something more. It feels like there's a blockage in my lower esophagus. And so he scheduled me for an endoscopy. I'm not sure if you guys know what that is, but it's when they have a tube they put down your throat with a camera. And sometimes, a lot of times they sedate you. When I got it done, they gave me like something, I think, to numb my throat. So I'm sitting there wide awake as they're shoving this tube and camera down my throat. Imagine how scary that was. About a week goes by. I don't hear nothing from the doctor. I finally call him, and he says, yeah, we have your results, sir. So I'm like, okay, well, what are the results? He said, everything looks pretty normal. I'm not sure why you're having problems swallowing food. And I'm like, what the heck? So everybody usually know your own body, and I just knew that something wasn't normal. So I remember I had to go to another specialist because I was like, this guy, he doesn't have any clue of what's going on. He's just kind of pawning everything off on everybody else. So I had to go to a different specialist, and I contacted this specialist, and I remember he's like, well, let's get you in for a barium swallow test. If you don't know what a barium swallow test, it's when you drink like this chalky contrast. It's really disgusting. And you drink it and you stand in front of an x-ray machine, and it shows if the barium's actually going into your stomach or there's a blockage in there. So after looking at the x-rays, he did notice that there was a blockage, like your lower esophageal sphincter opens and closes every time you eat food, and mine was just staying shut. So the contrast was just stuck right in my esophagus. It wasn't going into my stomach or anything. It was just sitting right there. The doctor wanted me to go in for an additional test. It was called an esophageal manometry, I believe is the name of it. I'm not 100% positive, but I know they put a tube through your nose and it goes back down your throat, and it has like little notches on it. I believe they're like pressure points or whatever, so you can check on the computer the pressure of your esophagus. So what you have to do after that tube is in your nose and down your throat, you have to take sips of like Gatorade, or I think it's Gatorade. I don't think they did water or anything. And then what they do is they test the pressure of your esophagus to see if it's, because everybody's esophagus pushes the food down and whatnot. So they want to test the pressure of that. So if all y'all don't know where I live in Wyoming. So I don't know if you know anything about the states or anything, but Wyoming is like way behind the times on everything. Medicine, technology, everything like that. So of course, I get this nurse that she's telling me this is the second time she's ever done this test. But here's the problem with doing this test is my nose has been broken multiple times. So my nose is kind of crooked. You guys could probably tell. So only one nostril is completely open. So I'm trying to tell this nurse, I'm like, because she's trying to shove it up one side and it's not going in because my deviated septum. And my nose starts bleeding. I'm about to pass out. My head's pounding. I'm like, come on, lady. So she's getting mad at me. Well, if we can't get the tube in your nose, we can't take the test. I'm like, well, try the other nose. It took some convincing to try to get her to actually listen to me and to do it the way I told her. So she finally does it the way that I suggest. And it works. It goes into my throat and all that stuff like that. I do the test or whatever. And then I think it's about another week the test results finally come in. And the doctor tells me that I have achalasia. And of course I'm like you guys, like, what the heck's achalasia? So I did a little bit of research on my own and figure out what it was. So I'm trying to talk to the doctor about, what's the next steps. But I'll go ahead and let the doctor show you guys what the treatments are for
The
achalasia.
treatment of achalasia comes in various forms. It goes from medical treatment, which sometimes involves medications that can help relax the valve, which work in some folks for a short period of time, all the way to surgery that's designed to cut the valve so that it stays open all the time. The medical or non-invasive or minimally invasive treatments involve endoscopic dilation or placement of Botox into the valve to relax the valve, or using medications to relax the valve. These are effective in some folks, and we usually reserve them for patients who either cannot get to medical care right away or surgical care right away, or for patients who are not very good surgical candidates and will not tolerate an operation. The gold standard operation for the treatment of achalasia today is a Heller myotomy. This is an operation where this is the esophagus and this is your lower esophageal sphincter, or the valve. It is an operation that involves incisions, 5 small incisions, a laparoscope, which is a camera, and with the use of laparoscopic instruments, we cut the valve to allow the valve to stay open. This also allows us to give people a partial valve after this to prevent bad reflux, which can sometimes happen after the valve is open. This operation has been performed for over 100 years in one way, shape, or form, and works very well for patients with achalasia. More recently, patients have had a second option available to them. It's called per-oral endoscopic myotomy, or POEM for short. There are many layers of the esophagus. There's the inner layers, which is the mucosa and the submucosa, which is here, and this is the inside of the esophagus. Okay? And there are also muscular layers that surround the esophagus in 2 layers, 1 and 2. While the Heller myotomy involves cutting the layers of the muscle from the outside, the POEM allows us to create a tunnel in the space between the inner layers and the muscle layers over here, and allows us to cut the muscle from the inside going out. Both of these technologies allows us to open up the valve and create symptom relief for the patient with achalasia. However, this is an operation that's only been performed for the last few years, and while the short-term results are very encouraging and are comparable to Heller myotomy, only time will tell if they are comparable procedures.
After going through all the treatment options, of course the obvious thing is surgery. I'm the type of person, I don't like doctors, I don't like needles and stuff, but I want to fix the problem. I don't want to band-aid the problem or anything like that. So I'm like, I want to get the surgery. But, back to the old not having health insurance, I'm like, oh, great, I got to get this major surgery. Because I think the surgery was like $100,000 for that Heller myotomy surgery. So I'm like, oh, great, no insurance. But I'm like, well, maybe I could get assistance programs, because it's kind of a life or death situation. It's just not a foot surgery, knee surgery, or something like that. It's a pretty, hefty surgery that's going to save your life or not save your life if you don't get it. So I explained to the doctor, I want to proceed with the surgery. So he kind of looks at me funny and he says, I have some bad news. And this is the funny part about living in Wyoming. There was no trained doctor that knew how to do the Heller myotomy surgery or had enough experience that was confident enough to actually perform the surgery. So the only place that actually did the surgery closest was Colorado. So I called this specialist. It's the University of Colorado Hospital. And once I tell them I have no health insurance, they don't want to help you because you live in Wyoming. They said if I lived in Colorado, there's assistance programs that they can help me get the surgery. But since I live in Wyoming, I was screwed and I had no insurance. So I had to call the doctor back and tell him, well, Colorado can't help me because with my no health insurance situation. So he said, well, you have 2 options. There's a balloon dilation or a Botox injection. And I don't have enough experience doing the balloon dilation. I don't feel comfortable enough to do that. So pretty much the Botox was my only option. So at this point, I'm between a rock and a hard spot. I didn't know what to do. I know he explained the Botox. They put like a tube down your throat with a needle on it with the Botox, and they shoot injections in your lower esophageal sphincter area. So it relaxes it so it opens when you eat. But the only problem with that is it doesn't last long. I think they said it lasts about 8-9 months. But I'm thinking, all right, well, if I can get a job with insurance and then get the actual surgery, maybe this could tide me over. I go in for this surgery, or well, it's kind of a surgical procedure. It's an outpatient, but what they do is they got to knock you out, then they put the tube down your throat when you're asleep, and then they wake you up, obviously. So I remember going in there, and of course, the nurse that I had was the dumb lady that shoved the tube up my nose, made my nose bleed. I'm like, oh, great, I got to deal with this lady again? Of course, the lady was super respectful, super nice when the doctor's around. Yeah, go figure. So anyways, I get the procedure done, and they're wheeling me out, to the car or whatever. My mom's there and whatnot, and the same lady, the nurse, had to wheel me out. I'm like, yeah, I can't even shake this lady. I can't get rid of her. So I'm thinking, she's been nice. I'm going to give her another chance or whatever. So I go to get up out of the chair when we're about to get in the car. This lady literally grabs my neck, coat area, and pulls me back down in the chair and says, "Sir, you can't be getting up. You could fall down. I could be liable." And I fucking shook her off. I said, don't grab me like that, lady. My mom was mad. I thought my mom was going to beat the lady up. It was just ridiculous. I go about 7-8 months, and, I'm still having problems eating. It's nothing foolproof or nothing like that, but I'm actually getting some food into my stomach and, gaining a few pounds or whatever, because once I got to my worst point, I was really skinny. So anyways, about 7-8 months go back, and I'm back to throwing up like normal. And they did say about 8-9 months, so I'm like, great. So I didn't have insurance. I had the same dumb job at the point. So I'm like, dang, I got to call the doctor back. So I called the doctor back and had to schedule another Botox, so number 2 Botox treatment. This time I didn't have psycho nurse or whatever. I don't know if, she talked to the doctor or whatever happened, but I know she's been there, years. But anyways, this time it lasted about 5 months, so I'm back to throwing up again. I'm like, dang, I still don't have a job with insurance. So I ended up having to call the doctor back and schedule a 3rd Botox injection. And keep in mind, I was getting bills for I think it was around $4,000 for every time I got one of these procedures done. This time, about 3 months go by, same throwing up. So we come to the conclusion that my body just was immune to the Botox at this point. And he didn't want to do any more procedures after that because of the scar tissue. You keep injecting, there's too much scar tissue and it makes it worse. So I ended up getting a job with insurance or whatever. It was a shitty, custodial, cleaning shitters job. But it was a job, it had insurance. But the funny part about that job is I had to wait a whole year. So in this whole year, I went from 210 pounds to 129 pounds, which I'll show you some pictures at the end of this video, or at the end of this clip or whatever, of how skinny I actually did get. This whole year was a nightmare. I was losing weight like crazy, and I was almost to the point where I was going to have a feeding bag in my stomach. It was so bad because I was so weak. I was dizzy all the time. I couldn't get no nutrients in my body and stuff like that. So I go to Colorado, I meet with the specialist, I get all approved for the surgery, and I schedule an appointment, which I had an amazing surgeon do my surgery. Once I'm talking to the people, setting up the surgery and everything like that, they said you'll be in the hospital about 3-4 days. And I'm like, oh, great. And this is back when me or my mom didn't have any vehicles or anything like that, so we had to get a ride from, my cousin or whatever to take us down there. So I'm like, oh, great. So I talked to him. I said, well, is there a place for my mom to sleep? Oh, yeah, no problem. They have guest rooms and stuff that people can sleep in and stuff like that. So I'm like, all right, that sounds good, And the funniest part about it's in Denver, Colorado, and it's on, the worst neighborhood ever. It's Colfax and Peoria, which is, not a good area. So it's not like I can just send my mom, hey, go to the hotel down there. No, I couldn't do that. So she had to stay with me, or not go for the surgery. So I get all prepped for the surgery. I'm signing all kinds of crazy paperwork that's saying there's a chance you could die and all kinds of, which is obvious in surgery, but I'm like, oh, great, So I'm getting all nervous at this point. I'm like, great, I don't even like doctors. I don't like needles. I don't like any of that. So I get in there, and I think I had the surgery scheduled for 11 a.m. or 10 a.m. I think it was 10 a.m. or something. It was kind of earlier. So I get in there, and I guess the doctor had to have an emergency surgery on somebody, so they postponed my surgery for 2-3 hours. So by the time I mustered enough courage, I'm like, all right, I'm here, I'm going to be fine. Then I have to wait another 3 hours. So I'm like, oh, great, So I'm all upset at that point, oh, great, I'm all scared. I got needles in me and all kinds of stuff like that. They tell my mom it's going to be probably 3-4 hours for the surgery. So I think 7-8 hours go by. I finally get out of the surgery. You can tell my mom's probably freaking out in the waiting room, waiting this long. Oh man, it's supposed to be 3-4 hours. It's 7-8 hours. What, did something happen? So anyways, I get out of the thing or whatever, and I don't remember much of getting out of the surgery or whatever. So I go in the room, and I remember they told me, they go, well, you got about 60 minutes to go pee. If you don't, we got to put another catheter in. So they end up putting a catheter in the first time, which I was asleep, thank God that they put the catheter in or whatever. So I think about 56, 57 minute mark, I finally could urinate. I was all scared. I was like, I don't want another tube in my dick, you know what I mean? So I finally get able to go pee, so I go pee. So it's nighttime, time is rolling out. Mom, I had a room with 2 beds. So my mom, we both kind of assumed that she was going to sleep in the other bed, and I was going to sleep in this one. So my mom gets her stuff, gets on that bed, and a nurse comes in and says, ma'am, you got to go in the waiting room. And I'm like, wait a second, like, they said that my mom could stay here. Oh no, she can't stay here. This is for like other patients. And we're like, well, I thought she had a room that she could sleep in, the waiting room, for 4 days? So my mom's all freaking out. She's upset. She's old. She has bad arthritis and stuff. She can't be sleeping in a chair for 4 days. And like I said, it's such a shitty area. I couldn't just send her down the street. They end up putting like a bedpan next to me to pee in. And then the next day they said they would walk me so I could get some circulation going. What they did is they put these things on my legs that contract and decontract so I don't get blood clots in my legs. But I had to call the nurse every time my bedpan was full of urine. It was bad there. The surgeon was amazing, but the whole hospital was so dirty. We took so many pictures throughout these 3-4 days of trash cans overflowing, bloody gauze pads on the ground. I don't know if I still have the photos, but I'll try to put some in this video or whatever. But it was really bad there. Matter of fact, the next day came rolling around, about 3/4 of the day went by, and I said, hey, is somebody going to walk me so I can get out? And they finally brought someone to walk me. I forgot to tell you guys, my mom finally got this little room with this little tiny pull-out bed, which she said was super uncomfortable, and that place was dirty as hell too. But she actually got somewhere to rest her head for a couple days, so that part wasn't bad. But I remember, I think it was day 3, I believe. I'm like, can I take a shower? And they're like, yeah, you can take a shower. So I go to get my stuff ready to take a shower, and there's no towels. So I called the nurse, and I'm like, can I get some towels? Yeah, we'll be right in. I think 2-3 hours went by, and I finally, looked out the door, and there's all these CNAs or nurses or whatever sitting there eating food bullshitting. And I'm like, can I get some towels at this place? They finally brought me some damn towels. But that hospital, as far as their surgical departments, amazing. But their nurses and the cleanliness was fucking terrible. I should have wrote a bad review about them, but I never did. So let's talk about the recovery. I had what they call air bubbles in my chest, because what they do when they put the cameras and the tubes in there, they blow up your chest so they can see in there and do the surgery. So I had all these air pockets. It almost felt like I was having a heart attack in my chest. And they said it's equivalent to some woman getting a C-section or something. It's kind of the same procedure. So I feel you women out there that's ever had a cesarean or whatever. I know, I kind of have an idea what you're going through. Not completely, but I have an idea what you had to go through. And I remember I couldn't lift nothing, but I recovered. I ended up getting the surgery 2014 in September. It's almost been going on 5 years this year. And, I still have to eat kind of slow at times. I can't eat certain, thick breads and lots of fries and pastas and stuff like that because it'll still kind of get lodged. But I eat good for the most part. And I've gained a lot of the weight back, which is kind of good, but it's kind of bad. So I need to lose a little bit of weight. But when you can't eat for years, you just, you're happy to eat something. So, but thank you guys again for watching my videos. Like I said, hit the thumbs up if you like the videos. I'll do a lot more story times. And this is my story of living with Achalasia. We'll see you guys next time on The Life of JT.